The femur, or thigh bone, is the strongest bone in the body. When fractured, it requires surgical stabilization. The surgeon makes a small incision near the hip and inserts a guide wire into the bone's hollow center for alignment. A reamer enlarges the canal, and a titanium rod is carefully inserted to stabilize the fracture. Locking screws are placed at both ends to prevent movement, ensuring proper healing. With time, the bone heals around the rod, restoring strength and mobility. This procedure speeds up recovery and helps patients return to normal activities. Keep watching this video.